Yeehaw!
There we go. Alright, we got Matt here from Aetna. He's going to do a little bit of going over products and Aetna training and hospitals and why to sell the product, all these good things. Please hold your individual questions. If you have a general question going to ask me about hospitals, networks, things like that, and any individual questions about contracting and applying anything like that, please hold that till after. He's going to stay after and answer some individual questions. We also have a lot of announcements to go over today, so we're going to do that right after Matt gets done with the meeting. So please don't get up and run away because we've got a lot of things to go over. We only have a week left before we start AEP. So we want to make sure we get all the information to you. If you need anything else to eat, drink, or you're good about it, go do that. But please give Matt your undivided attention as he's getting all the information and really going to be a great product this year. So, yeah, welcome Matt, and please keep the comments down until the end. Thank you.
All right, good afternoon, everyone. Like Scott was saying, my name is Matt Smith. I am new to Aetna, but not new to the insurance business. I started with a company about 10 years ago called Kanawha Insurance there in Lancaster, South Carolina. So I was a career agent with them for a couple years. And then from there, I got the opportunity to come over to the Humana side and work with external agents like yourself. So I was over at Humana, kind of the same thing, broker relations type manager over there at Humana. The biggest difference is you guys probably didn't hear a lot of me because I only work with independent agents and Humana brokerage agents. So if you had an upline, you probably never heard from them. They're very siloed over there. You know, you got career, external, FMO. So very siloed channel. So I'm excited to be in Charleston working with all agents. At Aetna, we don't have any captive agents, so if there are ever opportunities to do seminars, you know, lead flow, things like that, we might have the opportunity to work with you guys on that. And like I said, we don't have any captive agents, so I get paid on what you guys write. So anything I can do moving forward to help you guys out, especially in expansion territory with the Aetna products, feel free to give me a call. If you're in home in an appointment, for example, you want to sell Aetna, but you have a burning question about a benefit, send me a text. Say I'm in home, I'm in the appointment. I'll drop everything I'm doing and make sure I answer that question for you. Because I know if you guys aren't comfortable selling that product, you're going to turn around and grab the United you're used to selling, comfortable selling, and you're going to sell that product. And if you don't have one of our kits in the back of your car, you're going to do the same thing. So we've dropped some kits off. I'll be here weekly. What I'll also do for all agents in the Charleston area is about every other Wednesday, you're going to start to see emails. You'll actually get calls out to you, letting you guys know where I'm going to be. It might be in like I do the Marriott a lot. I'll be at the Marriott from 10 to 12, for example, on a Wednesday. It's called a grab and go. You come to the grab and go, you grab materials, get you a cup of coffee, answer that burning question, and I'll send you out the door. So, I mean, it's that easy. Nothing formal. Today's not going to be formal, but what I'm going to go over is going to be, can we dim the lights? Yeah. I'm going to go over the market-specific training. So you guys saw the public market-specific trainings that we sent out there on the AetnaMedicare.com. Maybe a couple of you came to them. But I'm going to go over that. This is going to sign off on you attesting that you guys came to a face-to-face training. But I did want to start off briefly. I just want to play a video to kind of highlight our national network. I think that's not talked about a lot. I don't know if you guys knew this, but our group Medicare and our individual Medicare is all one national network. Okay, it's a national PPO network. So, you know, if they want to go in, you know, if you're in Hilton Head, for example, you want to go across the line into Augusta, Georgia, where we have a lot of providers in network, you know, they can do that, you know, without having any type of authorizations going from, you know, across state lines. So there's a lot of kind of wow features or why Aetna features that I'm going to talk about to kind of set us apart. You guys can read plan guides. I mean, you're going to see what the benefits are, but I'm going to get a little bit in the weeds as far as, you know, what's going to set us apart in certain instances. You know, we're not here to take over the world, but it's a good fresh face, especially in the lower part of the state. And we just want to be a consistent message, you know, and an option to your members. I think they've done a good job as far as the plan design. But I'm going to play this video real quick. It's kind of highlighting our national network.
What do you get when you combine the medical expertise of local health providers with Aetna Medicare experience and national resources? The Aetna Medicare PPO plan, a total approach to health and wellness. With Aetna Medicare PPO's network, you have access to trusted local medical professionals and top national providers. Our national PPO network covers 31 states and offers direct access to over 700,000 doctors, over 3,000 hospitals, over 65,000 network pharmacies, and added savings opportunities at over 23,000 preferred pharmacies. Working with your doctors, we can take care of the whole you through a powerful blend of patient-centered care, coordinated services, and coverage that protects you while you are on the go. Aetna Medicare PPO plans support your whole health, body, mind, and spirit. We believe that getting the right care at the right time and place can help you keep pursuing the life you love. Local care teams include health experts from Aetna and network providers. Together, we connect you with care resources to support your unique needs and personal health goals.
Everybody is working together as a single team to help you become as healthy or avoid the progression of disease as much as possible.
Aetna PPOs include your Medicare health and prescription coverage, as well as extra benefits like fitness, dental, hearing, and vision into one simple plan. No medical underwriting is required. Plan designs make care convenient while protecting you from unwelcome financial surprises. Here's an example. Let's say in an emergency, you need to be transported by air ambulance to a medical facility. That can be an expensive event depending on your Medicare coverage. However, as part of Aetna Medicare's national PPO, your cost for that flight is the same as a regular ambulance, giving you the coverage you need when you need it. Aetna Medicare PPO is Medicare inspired by the whole you. Our total approach to care helps you live life your way and provides the protection you need to explore adventures ahead. Contact us to see if Aetna Medicare PPO is the right plan for you.
So that's a good introduction to our national network, and as you saw, one of the key selling points on that as well was, whether you're in the Bird or you're in an ambulance, it's the same. It's going to be equal. It's a $250 copay on all 7 PPO plans that we have this year for Aetna. So you guys are the last market-specific training I've done. I've done 14 of these, so I'm gonna get it down to about 45 minutes. I'm ready to go home and hang out with the kids a little bit. But so what I'm gonna do, I'm gonna go through kind of the why Aetna, touch on a little bit about us. Then I'm gonna flip-flop from traditional market-specific. I'm gonna go straight into the products. We'll talk about network, and then I'm gonna talk about some enhancements we have to like Ascend, our electronic enrollment, and then we'll get you guys, back to your day. As far as certifications, we do it a little bit different. We require you to do certification first, especially if you're new. I've talked to a lot of brokers in South Carolina about this because they're new coming on. We never had any products in their area. So we do 2019, you do certification first with AHIP. Once you do that, you contract. Once you're contracted, you'll get your 2019 ready to sell notice. It's an email that comes from broker support, and it'll break down what market you're available to write in. So it'll say Mid-South, and the Mid-South is actually North Carolina, South Carolina, Tennessee. Now, if you guys are going into Georgia, you just jump on a Georgia webinar, for example. We still have some webinars out there. They run them weekly. We call that the Deep South market. So here in this area, South Carolina, Georgia, they are 2 different markets. That's the Deep South. So if you want to learn about their products, just jump on a webinar, shoot me an email. I'll send you the link so you can sign up. And then from there, when you get you ready to sell notice, we do invite you, and you do sign off saying you attended a market-specific training. That's what I'm going to sign off on for all you guys today. So, as far as why Aetna, this is just a neat fact. I didn't realize that we paid the first Medicare claim out of the state of Texas years and years ago. Aetna's about a little over 150 years old. And like I said before, we've actually had group Medicare in the state of South Carolina for several years. That's why it was a lot easier for us to go after our bigger affiliations and get those contracted first. Now, you guys know better than we do, those PCPs and those specialists that might not be showing on DocFind are the smaller affiliations. If you run across those, please contact me because I'm the one that nominates those. And it's as simple as giving me a name. I forward it up on a nomination sheet, and then our provider relations team will reach out for them. So I've already nominated about 14 or 15 in the past week, specifically for that Chesterfield County area because we picked up the McLeod Hospital system, which I'll talk about. So a lot of neat things coming around the corner. Currently, we're in about 54 million we reach about 54 million Medicare beneficiaries across the United States in our national footprint. That's going to be a big expansion this year. South Carolina is actually the second largest expansion nationally for us, and we've added 23 counties. Star Leader, last year we were the Star Leader. 87% of our plans were 4+ star plans. That was about 250,000 enrollments. As far as why stars matters, you guys know, getting independent applications quicker, doing electronic enrollment to have hard stops opposed to paper applications, getting your clients to do their preventative services, go get their flu shot. All those things help drive star ratings. The higher the star ratings, the more benefits we can put in, like adding dental allowances, adding vision allowances, adding OTC, adding transportation, things like that. So the higher, you guys are the front lines of this, so you guys do affect the outcome of our star rating. So we appreciate, if you're writing in the upstate, we're going to be at 4 stars again on that plan this year. Entering the new market, we'll be at 4 stars on the remaining 6 plans that we'll be bringing into the market. So you guys have a lot to do with that. You guys have seen this before. I mean, the biggest thing I see here is 30% between 2020 and 2030 is going to be a 30% increase of the agents, 65 and older. So a huge opportunity. If you're writing in the ACA space, we all know that they're going to have to age in at some point in time. So that just increases your persistency across your book of business. Either that or you're going to be referring out to your buddy who he's going to write it. And he'll write those drug cards now because, even those commissions are going up. As far as our growth, 9.8% during AEP last year. The industry was about 3.9%. As far as lock-in, this is what we call outside of AEP. Anything outside of that was 2.3%. The industry is about 0.6%. Okay. As far as our strategy, it is real simple. I mean, they are trying to go big. They're going to be this year in the 2019 expansion. We'll be in about 75% of the covered eligible footprint. For 2020, we'll be in right at about 85%. So another big expansion for South Carolina next year. Okay. So especially with some hospital systems we picked up. We wanted to go there this year, but we were a little late to the game getting the agreement signed. We couldn't file a claim. Dual eligible plans, if you guys are venturing into Georgia, they do have one in certain counties. South Carolina, we don't have any here. So, you'll have to go to your Humanas and your Uniteds for those dual eligible plans. Year-round marketing, we did introduce year-round marketing. So on our Medicare Marketing Studio, there are pieces that are available for you. There's generic pieces, there's Aetna specific pieces. They got the 0 premium PPO, silver sneakers, tier 1, tier 2, $0 copay, national network. They kind of give the why Aetna or the sizzle as far as the 3 selling points. So some neat brochures. Just go out there. If you guys are doing some smaller group type settings, you can customize those. You can actually put your events on there and pass them out however you see fit. If you are going to download them, they're free. But if you're going to print them, there's a cost to it. So just want to let you guys know about that. As far as getting personal, we added an Explorer option to our plan, which I'll talk about. Long story short, you can be outside your service area for 6 months. With our Aetna plan, you can be outside the service area for 12 months with our Explorer option. Get access to CVS Minute Clinics, PCPs, wherever you are in our 43 state footprint. So we'll talk about that. As far as bringing care home, on this slide, we did add post-discharge meals to all of our plans. So all 7 plans have post-discharge meals. I have a slide on that. Service and support. I'm your frontline contact in regards to support. Like I said, if you're in an in-home appointment, please call me. My contact information is on the card. It's on the plan guide, so you guys have that. This is kind of a nice, neat little folder. I have this in my Aetna applications, and we should be able to work fairly well together. It's kind of your abbreviated brink book that they give you with Humana. We'll call it the MAP PDF or whatever you want to call it. So, Medicare Broker Services Department, that's the 866-714-9301. There's a slide in there. There's a 1-page snippet in your kit for that. Any pre-enrollment or post-enrollment issues, always start with them first. And from an independent agent standpoint, calling in, we get it logged. That's going to hold Aetna accountable. We got it logged into the system. Now we can chase it around a little bit. And start there. Now, if you don't like the answer, we have some additional research, some additional information that needs to go back to that issue, whether it's pre or post-enrollment. Then that's when you can contact me, and then I can kind of pick the ball up and run with it from there, allow you guys to keep selling during the selling season, and I can help put out those fires. I do have a broker liaison that's dedicated for the state of South Carolina. Her name is Jessica Patterson, so she can handle anything pretty much real time for us. You know, there's no sending an email waiting 3 to 5 days. We provided this to you. If you are ready to sell, you get this in the weekly email. It's a making it easy to do business with Aetna. It's just gonna break down everything from where, a link you can click on for your enrollment kits, how to get to Producer World, how to get to the Medicare Marketing Studio, how to get to our online enrollment. If you haven't requested that, talk to Scott. He said a lot of you guys already have access if you don't already. Your reporting is in Aetna Producer World. In-network doc find at hospitals, that's where I'd like you guys to go out there and start looking up those PCPs, especially for your existing members. Make sure they're in there. And if they're not, and they wanna be, or they're not, we just missed it, let me know so I can get them added. For our purposes in South Carolina, it's only gonna be Aetna Medicare. We're not gonna do anything with the Coventry link. Same thing for in-network pharmacies. There's over 23,000 preferred pharmacies with our plans this year. So you'll have access to that as well. Like I said, this is just reiterating, you know, what you have available in Producer World. Sales presentations are available. Those were out last week for 2019. You can order your enrollment kits. That's where you can personalize them. The ones I bring to the agency aren't personalized, but so just keep, you know, steady ordering as many as you can whenever you can. But we'll also make sure, you know, you're not empty with kits. Commission information, application status reports. The 2019 DVD, it went out 2 days ago, and it's on Producer World. So the instructions for the DVD, if you don't like, you know, rocking and rolling with the PowerPoint, you can use a DVD. I'm kind of a PowerPoint man, but the DVD is available. This in this PDF that I'm actually covering, this is things like 70 slides, so you don't need to write anything down. When you go into Producer World, it's there. You click on self-study and you can download this whole thing. And then you can toggle between the Why Aetna, the tools and support, and the product-specific information. Compliance information, we gave you, you know, where you can get your compliance information. They stick the marketing do's and don'ts up there. Top 10 ways to avoid complaints from what we see at Aetna. We kind of provided that, what you could do to kind of help us with that. Like I said, I'm gonna click through this and get to the products. Election periods. Biggest one this year, we got an OEP. OEP is January 1st to March.
You don't have any notifications.
What was that?
You don't have any notifications.
Oh, I got you. So with the January 1st to March 31st, we do have an OEP. Long story short with this, they gotta have an MAPD to be able to take that OEP option, okay? I got you a nice little slide that tells you who can get it and who can't, okay? Again, it's available on there. If you want me to copy and paste it for, I can send it to you, but this is on Producer World, so they gotta have an MAPD to be able to use that OEP. If they're on original Medicare and a drug card, does not apply. So we broke that down for you. There's a lot of what you can't do and what you can do. We know there's some bad apples out there that probably are gonna market it. If you do use our PowerPoint during your presentation, it does have a slide on MAOEP to let them know what's going on with that. So we kind of already put that in there. On the enrollment kits, we added it to the election periods. It's the first option, MAPOEP. Okay, so we have that for you. SCPs, you know, no more monthly. We're going quarterly now. So you have quarterly options. So January, February, March. And so if they take one in April, they'll still get their May effective date, but they use that second quarter SCP. First 3 quarters are going to be the dual eligible SCP. Obviously, if they're in the fourth quarter, we're going to use the AEP code. Front runner status, we did change this. Some of you might have hit this last year just with our PDPs. We have a strong PDP portfolio, but we did tweak it though. So the PDPs in South Carolina aren't worth a full point anymore. They're worth a half a point because we have MA products. So you got to get 25 points only during AEP at this point. We're trying to get it through the whole selling season. But if you give us 25 points during AEP, the biggest thing is we're going to pay, when you go in your system next year, this will be waived for you, for your AHIP certification. Wow. So 1 point for MAPD, half a point for PDP, get the 25 points, we'll pay for your AHIP. They do give you some signage announcing your status. There are some discounts for printing with Staples. We provide you with our code for that if you hit front runner status. And then there's some discounted rates for Kaplan. Kaplan's pretty hard when it comes to CE. I get the 24 credit package thing. It's a little easier. So I don't know if that's the highlight of it, but the biggest thing is, I I mean, we're gonna pay for that AHIP next year, so that's just a good goal for us all to maybe shoot for, see if we can pay for that AHIP. All right, so let's get into the plan, guys. I'm gonna switch focus. You guys pull out that plan guide that you have. It's a separate piece of information. I'm gonna minimize this real quick, and then we'll kind of jump into the plan guide and get into the.
Any extra ones of this?
Yeah, I'll get you some extra ones. Well, I thought I did.
Just that little bit of state map on it.
Yeah. Let me see. You know what? I don't know if I got one on here or not. We'll get you one.
Okay.
All right, so these are our 2019 plans. All 7 plans are PPOs. We introduced 6 to the market this year. Good thing about it, all of them are in one kit. So you have one kit for the MAPD, you have one kit for the PDP. And I'm almost positive with the summary of benefits, it's gonna start with the existing 140 plan and go left to right. So that Charleston plan is gonna be the second one in the kit, okay? So this orange color here up in Clemson territory, that is the existing 140 PPO plan that we had. Not gonna talk a lot about it, but here's the counties. We did add Anderson, Cherokee, and Oconee County. That Anderson's a big play, a lot of Medicare beneficiaries there. We have ANMed, we have all the hospital systems. They needed something for years out there. So my wife's from the Anderson area, so it's gonna be a good option for them. Anderson, Cherokee, Greenville, Lawrence, Oconee, Pickens, Spartanburg, and York County, where I live currently, that's your 140 plan. Our light blue is gonna be our Berkeley, Charleston, Collington, and Dorchester plan. The green plan is gonna be the Lexington, Richland. This orange right here surrounding Richland and Lexington, that's the Calhoun, Fairfield, Kershaw, Orangeburg, and Saluda plan. Up here in McLeod Country, we have the Chesterfield, Dillon, and Marlboro plan. Again, all PPOs, and 5 out of the 7 are 0, and we'll talk about the premium. Down here in the purple, we'll talk a little bit more in detail about these 2 plans. You do have 2 options in Beaufort, Hampton, and Jasper County. One has a premium, one's a 0 premium, but I'm gonna talk about that 0 premium. It does have a deductible to it for certain services, so we're gonna make sure we kind of get in the weeds on that a little bit. But this purple right here, that's the Abbeville, Beaufort, Edgefield, Hampton, Jasper, and McCormick plan. So we're gonna focus on this one. You're gonna see everything, but I'm gonna focus on this one. I'm gonna focus on these 2 right here. But I'll kind of highlight the key selling points, maybe 2 or 3 with each plan. So that upstate plan we had in the York County area, there were 3 asks last year. You know, we design our plans locally. I actually have some input in it, which I'm very excited about. We have a operations manager out of North Carolina and a GM out of North Carolina. They're more operational folks, so they work with us. They come out every year. We'll come out next year and we'll do a big old meeting and we'll ask, you know, what would you guys like to change about our existing plan that we've introduced? They asked for 3 things in the upstate. They asked for that $50 Part B give back. They asked for a zero PCP copay. They asked for a higher dental allowance, which I'll talk about, and they also asked for $0 labs. And you can see on a lot of our plans we have that. And they were able to give them actually 4 out of the 4 things that they asked for. So we do truly keep it local as far as our plan design. But so on that upstate plan, again, $0 premium, that one that's the only plan we have with the $50 Part B give back. $6,500 maximum out of pocket. You can see the PCPs and specialists. I'm not going to take too much time on this. Diagnostic radiology. So carriers are a little smart. Where you see a range right there, Plan Finder at Medicare.gov they're gonna go off that 0. So when you see the 0 to 65 range, in the state of South Carolina, 9 times out of 10, that diagnostic radiology is gonna be $65. Now, there are cases, for example, in our Tennessee market, where PCPs have MRIs and CAT scan equipment in their actual office. If this actually in their office, that's gonna be $0. Now, Tennessee is the only place I've seen examples of that. So for our purposes, we'll probably stay at right the $65 range for diagnostic radiology. X-rays 8, lab 0. So that's the upstate plan. Now here's our Charleston plan. $0 premium. Again, PPO. $5,900 maximum out of pocket for in-network. 10 for out. $0 PCP copay. $30 specialist. $340 per day, 1 through 5 for inpatient hospital stay. We got the better end of the deal on this one, $200 outpatient surgery here in that Charleston plan. 0 to 65 diagnostic, 8 x-rays, labs are at 0, urgent care 30, emergency room 90. Now, where we knew we were gonna have holes in the network, for example, when we started it, we don't have much MUSC in network. That's the only provider in this area that we don't have in network. But where we knew we were gonna have a hole in a network like MUSC, we were a lot more aggressive on the out-of-network PCP specialists and inpatient hospitals. So you're pretty much adding $10 if they're going out-of-network to that PCP, and you're adding 10 to the specialist. It's 20% for all inpatient for out-of-network. Okay, so same thing for these plans down here. We knew that they might come and travel up to MUSC, whatever the case may be. A lot more aggressive when it comes to the out-of-network. You're just adding $10 if they're going out-of-network with these plans. Now, we also did that with that Chesterfield plan, which is McLeod, but we did pick that hospital system up, so we don't really have to worry about that. So a lot more aggressive on the out-of-network PCPs and specialists. If you look over here more towards that Hilton Head area, we do have there's a $33 plan there in the Beaufort area. Now, if they're on LIS, that's only $14.10. That'll be in the chart. Okay, $5,500 same for annual max out of pocket for in and out of network. So $5,500 here. You have a 0 premium or 0 PCP there. You have a $20 specialist. Again, add 10 if they're going out of network. All the other hospital systems in that area and going into Georgia are in network. They picked up a lot of Savannah systems as well. Inpatient is going to be $275 per day on that plan, so that's pretty strong. Outpatient surgery $295. Now the biggest difference here is the x-rays and labs on this plan. They do have a copay to where, well, it's $8 on x-rays, same as our Charleston plan, but labs are $10 opposed to the 0 that we have here in Charleston. Okay? Urgent care, 20, ER's 90 on all of our plans. Now we also have a 0 premium option here, and I'm gonna talk a little bit more about this. It's a 0 premium option, and it does have a $1,000 medical deductible on inpatient services, okay? There's only 6 services that apply to that inpatient service, and I'll show you what that is. It's not gonna be a fit for everybody. To be honest, I think they kind of might have thrown that out there a little bit to try to grab a lot of that MA only business that was sitting out there, that regional business. But you know, a veteran that hadn't retired in that area, that's not worried about this $1,000, this could be a good plan to give them option to more providers and to give them options to an RX benefit where they could potentially get a tier 1 drug at 0. They might be paying a couple bucks to the VA. You're not going to mess with anybody on TRICARE for life or anything like that, but someone with just some basic VA benefits, this could be an option for them.
So if they have VA benefits and they take that, they can still get their stuff through the VA?
Yeah.
It won't mess up?
No, it won't mess it up. Now, if they got like TRICARE for life or
No,
TRICARE,
no,
yeah, we
no,
don't want to mess
that's-
that.
yeah.
Just basic VA non-retired, that'll be perfectly fine with that. So, $0 PCP, $20 specialist, again, where we're out of network, a little more aggressive, you're just adding $10 to that. There is a $750 per stay for inpatient, $295 for outpatient, $8 for x-rays, $0 for labs. Okay, another selling point with this plan, and like I said, it's not for everybody, but depending on who's in front of you, this plan has a $1,000 medical deductible, but it has no RX deductible. So when I flip over to the next slide, there's not going to be an RX on this. So someone on higher tier drugs needs access to more care, this could be a fit for them. Or someone would say $33 a month and spend that on golf balls, and that could be a good option for them as well. So let's flip over. So let's talk a little bit about our vision and dental benefits. So for our plan in Charleston, they get a $100 allowance for contacts and eyeglasses every year. This is a reimburse. So they get an itemized receipt, they pay for it up front, they put the first and last name member ID on it, they mail it to the address on the back of the card. Takes, let's go ahead and say 3 to 4 weeks instead of 2. It's 3 to 4 weeks just to kind of, you know, under promise, over deliver. So about 3 to 4 weeks they'll have that reimbursement. As far as preventative and comprehensive dental, $500 allowance. Last year in the upstate, that was $250. They asked for an increase and they moved that up to $550. So that was a positive for them. But $500 allowance, that's comprehensive dental. So that's preventative and comprehensive. That's a reimbursement as well, no networks. as long as it's a licensed dentist, not their brother pulling their teeth in their backyard, we'll reimburse them. Write me up a receipt real quick. So, very easy process. No networks involved. Again, $500 allowance every year. All of our plans have tier 1 and tier 2 gap coverage on them. So all 7 plans have gap coverage. Our RX deductible in this plan is $95. It only applies to 3, 4, and 5. Now when we get over to that premium plan in the Hilton Head area, it has a $195 deductible, but that's only for 4 and 5. So that's the biggest difference there. And then when you look at that $0 plan, there is no RX deductible for that. Okay? So also another huge selling point with this plan, in addition to a very competitive RX deductible, is the tier 1, tier 2 on our MAPD plans at $0 copay. That doesn't matter whether it's 30 days preferred, 90 days preferred, or 90-day mail order. So my dad's a good example. I'm not picking on Humana, but we put him on a Humana plan in York County. Tried to tell him, do the pharmacy, do the pharmacy. He didn't want anything. He don't want anything to do with the pharmacy. He's 78 years old. He could care less. So he passed it off on my mom. My mom didn't want to deal with his app and his mail order. And, he had to get 90-day supplies to take advantage of that tier 1 and that tier 2 drug. He was going to CVS. So now he gets to go back to CVS, get his 30-day supply like he liked it, so he's not hoarding warfarin, and, do a tier 1, tier 2 at $0. So that's a huge selling point. A lot of carriers out there, especially if they're giving you, for example, a Part B give back, they're not giving you tier 1, tier 2 at 0, and they're probably putting a $400 RX deductible on that. They're giving you the 50, but if you look at an example where we gave you the 50, we gave you a $95 RX deductible, tier 1, tier 2 at $0 labs. I mean, that's a lot more aggressive. Now, I know we don't have that down here this year, but even comparing a 0 premium to a Part B, you kill that down here. And a 0 to a 0, you still get it with the other services that you have available on a PPO. Yeah.
For the new people in here, can you explain real quick the tier 1, tier 2 gap coverage?
Tier 1, tier 2. So drugs are tiered depending on the formulary. So if they take a tier 1 drug for say 30-day supply, they can get that at $0 cost. And a lot of your tier 1 and tier 2 drugs, a lot of carriers are going to make their deductibles on their plans only apply to say 3, 4, and 5. So you can get those tier 1, tier 2 drugs at $0 automatically without having to pay that upfront RX deductible. Does that make sense?
The gap coverage.
So the gap covers. So when they get through the gap cover, when they get into the actual the gap coverage, they'll still be able to access their tier 1 and tier 2 drugs at the same copay. The donut hole, yeah. So when they're going through the donut hole, their tier 1 and tier 2 are not going to be affected on all of our plans. We're still going to pay that 0 or whatever that dollar amount is. Okay. All right. So RX deductibles, we have them here. The biggest thing with that Hilton Head plan, when it comes to dental allowances, you can see we got the better end of the deal. Upstate, Charleston, and that Richland, Lexington plan, and even the outstate. But when you get down to these other 2 plans, a $250 allowance and a $100 eye allowance, depending on what plan you take. Another thing that's different here is that tier 2 on that premium option. You can see there's a $10 copay there. All the other plans, it's 0. So I wanted to point that out. Silver sneakers, we use Silver Sneakers. Go to silversneakers.com. There's a hyperlink on there. You click on it, put in a zip code. You'll see all your participating gyms. It's not just YMCA anymore. Anytime Fitness. I'm from Fort Mill, South Carolina. Leroy Springs Recreation Complex is in network. So, it's in the Silver Sneakers, and they have been for 10 years. So, Silver Sneakers on all of our plans. And that portability option, that Explorer option, I have a slide that I'm going to talk to about on that. That's on all of our plans. We added post-discharge meal program to all our plans. And then we also added what we call Resource for Living, and I'll talk about it. I got a slide on that. So you guys have access to this. I'm kind of going to get into what sets us apart. But so if you deal in anything in the orange, Jeremy Bridges is the Aetna broker manager, what we call South Carolina West now. Feel free to call him if you're ever in the upstate. He'll take you to lunch, breakfast, whatever the case may be. If you need kits, we all one kit, so we can make sure you all get that. Everything in the green is me. Richland and Coastal Broker Manager. So if you ever need anything, again, there's my only cell phone number, my email address. You guys have it. Text me. Anytime you got an issue, it's always better, just with an expansion market, it's always better to email me the issue first, so I can call you back, hopefully with an answer, or just, looking for more information. That kind of helps, dial back on extra phone calls and things like that. So anything, put it in writing, that way I can research it first, and I might have an answer for you when I give you a call back.
I have a quick question on,
Yeah.
dental innovation.
Yes, sir.
You go send a check to they can go to any dentist or any eye place?
Yes. No network. Reimbursement. So they pay up front, we reimburse them back.
On the exams, is that included that $100 or is there? Like
So, yeah, that's a good question. So you guys are Scott's gonna get 2 documents from me. The plan guide and PDF that you got in front of you. You're also gonna get one that says draft across it. It's agent use only, but after you attend the meeting, I can send this out. But it's gonna break down a little bit deeper. Who asked that question? It's gonna break down a little bit deeper dive. It's gonna show you, hey, annual, vision exam, $0 copay across all of our plans. It's gonna, instead of saying just post-discharge meals, it's gonna say 14 post-discharge meals. So it's gonna kind of give you a little bit more description as far as what the services are, but yeah, so $0 copay for the vision. Now, with the vision, you do have to go to that in-network vision provider. With the allowance, you can go wherever you want for the contacts and the frame.
So there's a network for
There's a
that.
network for the exam, yeah. All right, so tools and resources. Again, we provided this for you at aetnamedicare.com/plan finder. For our pharmacies, you can access that here as well. Provider network questions. I do want to stop on this slide. I am going to skip over the kind of what's our strategy with the PDP formularies and drug coverage for our standalone PDPs, and I'll talk a little bit about why. But for provider network questions, broker services is going to allow South Carolina agents to call in and verify PCPs, whether doctors are in network, out of network. So if you see somebody that's not on DocFind, you can still call in the broker support. If they're saying they're in network, you can call them, they're verified, they'll give you the pertinent information. So you can use broker services in South Carolina for that. Anytime you're sending an email to brokersupport@aetna.com, feel free to email or copy me in on it. That way, if we need to ever, intervene, we can, and we'll make sure we take care of that for you. Medicare Marketing Studio, this is where you can get our customizable pieces. Again, download them, they're free. You print them, there is a cost to them. But if you're doing seminars, these type ads right here, you can put the multiple seminar dates on there, pass them out to let people know where you're going to be located. We use Ascend for our electronic enrollment application. Okay, with the Ascend app, you can do our MAPDs, you can do the PDPs electronically. There's electronic scope of appointment option on there, telephonic scope of appointment. You can order your kits from there. You can look up your providers from there. You can look up your preferred pharmacies. We have a benefits checkup within our Ascend sales office app that allows you to look up state, federal, to see if your clients qualify for state or federal assistance. LIS eligibility is also in there. So it's really just a one-stop shop as far as, it's kind of tile-based to where you can kind of put everything centralized. I know they've done some redesigning and reamping with that. So very neat feature. If you're doing electronic enrollment, you do have to be connected to the internet with ours. They are working on offline, but right now you do got to be connected to the internet to do the electronic enrollment. Enrollment kits, all one kit for MAPD, all one kit for a PDP. If you haven't ordered enrollment kits yet with your specialized information on it, you're probably not going to get them by October 15th, so just get with the agency and see if they can get you some. They'll verify you're ready to sell and they can get them. But once you can, get in there and order them because that's the ones you can customize with your own information on there. The benefits checkup, this is on Ascend. This is what I was talking about. That's just where you can look up eligibility for federal, state, and private programs. That's in there. Products and highlights, we covered all this. But I do like this slide. This kind of shows you where we were in 18 and where we went to 19. Another thing that's unique about Aetna is they already know where they're going for 2020. So I can tell you there's gonna be another expansion in South Carolina is what they're looking for. So yeah, so you take Georgetown all the way up through the McLeod bubble. Y'all might not get me next year, cause that Jeremy and me will shift like this, and I'll probably be up that way, but like I said, we might have 3 broker managers by that time, but we'll make sure we're taking care of you however we can. 45 states plus DC is where our footprint currently is. We have the 3 standalone PDP options in all 50 states. Like I said, we've had group Medicare in the state of South Carolina for several years. The United Auto Workers of America is one of our bigger groups. So we've had physicians here, so it's a lot easier for us to get at those bigger affiliations. 43 states, we do have Medicare supplements. I don't know if you guys are aware of this, we have Medicare supplements, and we have individual ancillary products. Not gonna talk about it today, but outside the AEP, you'll probably see us start reaching out to the agencies. We'll start doing some road shows, and we'll start talking about these products as well, so. But we're gonna stick to MAPDs and PDPs for the AEP. In 2018, additional covered eligibles we added was about 3.5 million. With this expansion, we'll have access to a little more than 7.5 million members. And then obviously next year, you can see we'll go up about another 10%. We want to be right at about 85%. We just reached 1 million members. And now they want to reach 2 million members in 4 years. So can't wait for that. So we better have some aggressive products. Saver, Select, and Value. These are our standalone prescription drug plans. I will show you the guide here. The average premiums, I can tell you South Carolina, I think that's $58 or $59. That's about right for South Carolina. I'll send out the rates. And that's about where they are for South Carolina. These are average premiums, but you can see where those deductibles are. Obviously, the only difference with this is the Select this year. Walmart is standard. They were preferred last year. They're standard on this, but Walmart is preferred on the Saver and the Value Plus. Okay, that's the only difference with our PDPs. No network disruptions. We actually added Ingalls to our preferred pharmacy list. So you can see the standalone PDP plans. I do want to mention this. You guys have probably gotten it at the email. Aetna is selling their PDP portfolio to WellCare effective 1/1/2019. They will officially own it 1/1/2019. We will service it. It will be Aetna branded all through 2019. Like any other plans that's been bought by another, I would imagine that it'll be Aetna branded for the first couple of years, being a good PDP that it is. But ultimately, I don't know whether they put it under their name, whatever the case may be. But we'll service it all. There's some good plans, and the reason I want to bring, because I know the Walmart plan went up substantially. So, I mean, these are some pretty aggressive plans, but you obviously got Silver Script as well and some other ones. So agents are writing a ton of this, and they did last year during AEP. So I just want to let you know, if you guys got a PDP book of business, we're going to continue to service it through 2019. You don't have to go out and get another contract or whatever the case may be. You can still write it under the Aetna name, under your NPN number. So nothing's changed from that perspective. But they will let you know probably right after AEP, where they're going to go with that as far as the name, the brand, and all that. Formulary and pharmacy information. Year-over-year stability was their main goal. This middle part right here, minimize disruption. And I can tell you, this is where they wanted to go with it. They wanted to be one of the richest tier 1 generics in the industry. 8 of the top 10 generics are covered on tier 1. On the PDP side, now on the MAPD side, I wanted to highlight this. So more tier 1 drugs are covered this year as opposed to last on that PPO. We had 349 last year, now we got 412. So we saw a lot of positive disruptions with the tiering of drugs. It affected like 24,000 members nationally. As far as negative disruption, it only affected a little less than 1,000 members nationally of us, say, taking a 2 to a 3 or, whatever the case may be. So they really wanted to keep that consistent. And like I said, I know they've added a lot of tier 1s. Like I said, 349 to 412. They did take some diabetic supplies, moving from 3 to 1. So what they're telling us, they've made a lot of enhancements to those. So go out there on Plan Finder. You guys, you're independent agents, put it in Medicare.gov, and it'll start spitting it out, and you'll see the truth. Preferred partners. These are our preferred partners. Kroger, Harris Teeter falls under that. You can see we added Ingalls on that. CVS, obviously, preferred pharmacy. That is gonna happen fourth quarter, and one of the reasons for us selling that PDP portfolio was, for that to be approved. You know, obviously, we couldn't have Aetna PDP and Silver Strip PDP all under one roof. They kept Silver Strip. They asked us to sell our PDP portfolio as a condition for that to go through fourth quarter. And for what we've been told, it's going through fourth quarter. So, preferred pharmacy list. I'll send this out with the plan guys too. We have a preferred pharmacy list for South Carolina, and it'll break down with those three standalone PDPs, who's preferred versus who's standard. Like I said, that this middle plan, Walmart is standard now, but it is still preferred on the other two, so it'll break down that for you. The Mid-South market, as you can see, dark purple is where we're going, light pink was where we were. Western Asheville and that North Carolina area, we're making a big push up there as well. So if you're ever in that area. And then real quick, yeah, I got about 5 minutes on it. I can answer some questions. But so that elite PPO plan down the Beaufort area where we have those 3 counties listed on there, what services don't apply to the deductible, what services do apply to the deductible. What doesn't apply, PCP services, specialists, things like that, routine x-ray, lab, diagnostic radiology, those don't apply to the deductible. What does apply to the deductible are inpatient and outpatient hospital services, ambulatory services, ASC, sorry, I'm going backwards. ASC services, skilled nursing facility, therapeutic radiology, all out-of-network Medicare covered services do apply towards that deductible. You'll have access to this. There's actually an agent-facing flyer that I'm gonna send out this upcoming Monday that kind of gets a little more in the weeds as far as what those services are. But we'll get that out to you. But this really is just, you know, what applies and what doesn't. Resource for living. Not gonna talk too much about this. This is just a research, it's something your clients have access to. They can call into a number and we'll research a lot of these services for them. They're not gonna get them at zero cost. We'll just help do the research for them. That's what the resource for living service on their plan is. I mean, it's anything from heat and utility assistance, realtors, dining, lawn and landscape. But again, it allows them, you know, offers real solutions. You know, they might not get out of the house much, but they're looking for someone to, you know, do their lawn or something. It'll help them research it for that. So just a neat little feature. So our Explorer benefit. This is for our traveling PPO members. And it's available in 29 states. It's on all plans in South Carolina. So coverage components, they get a travel advantage. They can be outside their service area for 12 months. They get ER coverage anywhere. They get urgent care coverage anywhere. They get access to CVS Minute Clinics, PCP coverage where we have an Aetna footprint. So that's 43 states. They also get a concierge travel call center, you know, as far as they'll help them find fitness locations for them. But I mean, they can pull up a Silver Sneakers put in a zip code to find one in another state. But so they can be outside their service area for 12 months and you know they get access to all these in-network services. Part B reimbursement. Don't have one here. As from an agent's perspective though, if you are writing other carriers, which I know you will be, being independent agents, this just kind of breaks down you know what happens. From an agent's perspective, you do the enrollment, Social Security is going to take care of the rest. Now, it might take them some time for Social Security to process it, so tell the member to keep paying that Part B premium in full until they're notified by Social Security Administration. And then from there, you know, once it's processed, they'll start doing their deductions. You know, obviously if it's in March, there'll be some adjustments for the first couple months with Social Security depending on how their elections are made. But, you know, they won't get a refund check back from us. It's not gonna come from Aetna. All that's gonna be handled through the Social Security Administration. But that's a $50 reduction to their Part B each month. So right there, you're looking at what, $600. GA, this is who we use for our post-discharge meals. Again, if your member is discharged from the hospital, nothing you need to do. I mean, it's a good outreach to them to say, hey, I know you've been in the hospital. I know you're discharged. GA Foods is going to be reaching out to you. Once they're discharged, GA Foods is notified. They contact them and they'll set up the meal delivery, the 14 meals. So what, that's 2 per day. So we're looking at 2 per day for 7 days for a full week. Now it's not gonna be Salisbury steak and fried okra. It's gonna be a little more healthier. But you can see what that kind of encompasses right there. Dental allowance, for our purposes in Charleston, we're what, 500, right? Okay. Annual benefit, allowances are member reimbursement, and members can receive services from any licensed dentist, no provider network. And again, that'll, they can use that for dentures, implants, all the comprehensive stuff. Eyewear allowance, South Carolina, again, what are we at, 100 for all of our plans? Annual benefit, they pay the provider up front, and then from there, they get a copy of the itemized receipt. It's first name, last name, Aetna member ID, mail it to the number on the back of the, or the address on the back of the card, about 3 to 4 weeks. Fitness benefit, we have silver sneakers. Flu shots, 2 ways they can do the flu shots. They can go to their in-network doctor, or they can actually access an in-network flu vaccine pharmacist, which is on our preferred pharmacy finder. So 2 options, they'll get $0. So there are a ton of these out there, 63 in-network flu vaccine pharmacists, so they can go there and get 0, or they can do it at their PCP. This helps drive star ratings too, so please encourage them to go get that flu shot. Diabetic testing supplies, we exclusively use One Touch, okay? So we use One Touch for the diabetic supplies, the Lancing devices, $0 cost share. This is something you can help them do. You can help them go to this onetouch.orderpoints.com, or you can call it in and give this code to trigger the $0 cost share. So the member can do it, or from an agent's perspective, you can actually help them do that and facilitate it for them.
Are there brochures for that on there?
Yep. So we have One Touch in the kits that are available. And it actually has, it should, if y'all look in there, it should have, well here, it should have the code on there, right? Okay. Yeah, so we got it's the last one, so it's the last one of your little one-page snippet. All right, next steps. If you're not ready to sell, complete your ready to sell requirements. You want to get that magic email from Broker Services saying South Carolina Mid-South ready to sell, and all other markets that you're selling in. Producer World has all your marketing do's and don'ts, the producer guide, understand those. All sales presentations and videos are now out on Producer World. Make sure you download those. If you haven't requested a send, request it. It takes about 5 to 7 days. There's a one-pager in there that you can follow to where they'll help you download it. There's actually an Ascend help desk. They're a lot better at it than I am. I'm not the technology guy. I came from Canal Insurance, so that's like stepping back in the 80s. So, yeah, so call them first, but like I said, start with them, and then if anything, I'll get an answer for us if you're having hiccups with that. But I helped an agent do it, and they jumped on the phone with them once I gave them the MPN number, and they had it done in 3 minutes. You can run test, dummy applications on there. Just put in a test disposition, so you can do that. Order your enrollment kits and marketing materials, and then we talked about the Front Runner program. My goal is to help you guys get to that Front Runner program, so I can pay for that AHIP next year. But like I said, we're excited about being in the state of South Carolina. I'm born and raised here. I'm excited to be in areas where I've seen, not a lot of carriers, so a new fresh face. Aetna is really simple to do business with. We gave you 7 plans, all PPOs. Pretty much 1 plan per county, unless you're going down there in the Hilton Head area for those 3 counties. So wanted to make it simple for that first year. But if you ever need anything, give me a call. I'm done with my little road shows, so I'll be stopping in, checking in with Scott, make sure he's okay, you guys are okay. But anytime I can field any questions, that's what I'm here for. We want to help you guys build that Aetna book of business, being a new face. So anything we can do to help do that, we'll help you. Does anybody got any questions?
Yes.
Yes, ma'am.
Sorry.
No, go ahead.
McLeod,
Yes.
Florence County. You said you've added some new ones here lately. I'm assuming it's before this was printed.
Yeah, so, all right, so in this snippet, and let's talk a little bit about network. So let's go ahead. In here, you actually have the South Carolina hospital list. McLeod's not on it. We're going to send an updated one for this. So we added McLeod effective 10/1. Now, if you go into DocFind, all McLeod affiliations should be there.
But products not available in Florence County.
Do what? But so, okay, so yeah, so the only plan we have available is going to be in the Dillon, Chesterfield, Marlborough County. So,
Florence,
not,
Louis, Louis,
not Florence or the
where
beach.
Cloud
No,
is.
no, not Florence or the beach, yeah.
I have a question.
Yep.
Okay, with this plan, the 251 for Orangeburg County,
Yeah.
okay?
Mhm.
A lot of people in that area, Orangeburg County area,
Yeah.
do not like to go to Orangeburg,
Yes, sir.
Regional.
Yeah, the Regional Medical Center. Yep.
Right, they don't like to go there, so they go to Trident.
Okay.
Now, I see you have Trident listed here,
Uh-huh.
but with them being part of the Midlands, Orangeburg County,
They can still access that provider.
They can
It's a
still-
truly a national network, so they can access those providers in network.
so they can go to Trident with no problem.
No
It wouldn't
problem.
be
They can go to
considered
Duke,
out of-
they can go to Emory in Georgia. It is truly a one national network. There's no authorizations to go from state to state. So if you have a plan, so if you take that service plan area for what, those 5 counties,
Mhm.
they can come down here to St. Francis. They can go up to CMC in Navant, in my neck of the woods. They can go to Tennant, which is Piedmont and Rock Hill, South Carolina. They have access to everybody in the network.
Okay.
Yep.
I got a question too.
Yeah.
You said out of network, inpatient hospital, if somebody goes out of network, say they go to USC. So you said that's 20%?
It's 20%, and on the other plan guide that on the city says draft on it, it's gonna break that down for you. I saw another hand somewhere, you good? Yep.
You see Trident Medical's in there, but Somerville Medical, is that all under Trident?
It's each, not listed on here.
It's Somerville Medical.
Well, it's Trident, it's Somerville, under Trident? Yeah, yeah, that should be,
Yeah,
that's
it's
one and the
HCA
same.
affiliated.
Yeah, yeah.
It's just something you said.
It's not, so I talked about the 20% when we were looking at the plan guide, for out of network. It's not on that plan guide, but it is gonna be on another one that I'm gonna send you guys. It's kind of gonna give you a little bit deeper dive.
Okay, and, on that plan 251, I didn't get one of those other sheets.
I'll email, I don't have any, maybe we can run one off. Yeah, we
Okay.
can just, let's just make a copy or something.
Okay,
Yeah.
because, everything else is basically zero,
Yeah.
but that particular plan is
That-
16.
That's 16, LIS 0. Yep. So $16, but if they're on LIS, that plan becomes 0.
Okay, you also said about, the plan, once you get on the site, if they are LIS qualified,
Uh-huh.
right? We still have to enroll them under the LIS.
Well, you enroll.
In other
yeah,
words,
they need to have the LIS.
They have to have
Yeah,
it.
yeah. So you help them get it. Once they get it, and they get that nice little letter saying that they're LIS, they now have it. Hey, call me back as soon as you get this letter. Then once they get that letter, you enroll them in that plan, it'll become 0.
Okay.
So also, I didn't talk, so hospital systems, they've done a good job as far as getting the bigger affiliations. We did add McLeod, so we're gonna add McLeod to that. Another big play is Lexington Medical Center. It is what it is. United's got about 6,000 to 8,000 members in that area that are affected in Lexington County alone. Good for us, they sent out a nice little postage mailer saying that they were gonna take Aetna and Blue Cross. I like being first in the alphabet, so Aetna first, Blue Cross. Now, I will tell you guys, there's another one going out. They did add Humana, so you'll have Aetna, Blue Cross, and Humana. But all those United members down there need a home. So if you do have some members up there, you're gonna wanna write them on somebody else. But we do have Lexington Medical. The only big one that we don't have, that a lot of carriers don't have, especially with our PPO, is MUSC. But we've sold for years in this area without MUSC, but if you have that client that goes to MUSC, it's not gonna be a fit for them. So you're gonna sell what's best for them at that point.
All the hospital lists, the LIS charts, everything's gonna be in your agent, AEP, it'll be very made for you, the John's gonna get out shortly. But all the charts for all the carriers, everything's gonna be in there. Don't worry about that, the whole hospital list, it's all together on one sheet, so it makes it nice and easy. And I did update it today for my class, because I didn't have it on there before. So, we have all that. And Matt, I'll get you a list of who was here today,
Yeah, so I can sign off on everybody.
so that way you can sign off on it.